Welcome to Newsroom Live, and thank you for joining us. I'm Steve Greenlee, the editor of the Portland Press Herald and Maine Sunday Telegram. One of the biggest stories of this year in Maine has been the very public dispute between the state's biggest hospital and its largest health insurer. The battle between Maine Medical Center and Anthem has centered on something healthcare consumers deal with every day: high charges and unreimbursed claims. Their disagreement prompted us to take a deeper look at a problem that most of us face from time to time. Most of us know that feeling of dread that accompanies the medical bill in your mailbox. Was my procedure covered? How much do I owe? Can this be right? As we began to report this story, we invited our readers to tell us about their medical billing nightmares. More than 100 did, and our healthcare reporter, Joe Lawlor, contacted every one of them. He ended up spending more than 3 months working on the investigation that we published Sunday. What it revealed will be familiar to many people. In its totality, it presents a picture of a system that is completely broken and in need of massive change. Joe and his editor, John Richardson, will talk in more detail about this story in a moment. But first, I want to thank our subscribers for their support. It takes a lot of resources for us to be able to do this kind of work, and it's because of you that we can do it. If you don't yet subscribe to the Press Herald, please consider doing so. Good journalism helps make us all better citizens, and in the case of this story, smarter consumers.
And now I'm going to turn things over to John Richardson. Oh, John, you're muted.
Thank you, Strawberry. Sorry about that. Thank you all for joining us. To be honest, I really didn't know what to expect. People would take time for a digital conversation about medical billing, always engaging topic of medical billing, but very pleased and grateful that you're here. We'll save some time at the end or toward the end for questions and try to answer as many as we can. But first, I want to get Joe to talk a little bit about his project and how he put these stories together. Steve mentioned our launching point, the starting place, which was the dispute between Maine Health and Anthem. And what that did really was pull the curtain back a little bit. It was a pretty unusual level of transparency into this medical billing world that so many of us have had our own difficult and frustrating experiences with. And we knew it struck a chord with readers pretty quickly. And Joe basically used that as a launching pad to collect stories and dig into this same problem, but from the perspective of patients. But Joe, I wonder if you could talk about that pivot and basically how you assembled the stories.
All right, well, thanks, John. Hope everybody who's joining us is having a good evening. Before I get into how we got into doing the story, I did want to point out that this takes a lot of resources to do this, and it starts with having a supportive ownership and supportive publisher and Lisa DeSisto, and supportive newsroom leadership and Steve Greenlee and everybody else. There's too many names to mention, and in addition to a good working environment with our union. And all this fits together like a puzzle in order to be able to bring not only this story, but there's any number of stories that we've done over the past some years, the lobster series, for instance, that have been just tremendous amounts of in-depth work. So that takes a lot of resources in order to do this. All right, so pivoting to how we did this story. Yeah, I mean, I think the healthcare system, and when you get a bill in the mail, like, we all kind of have the sense that maybe something's wrong, or we all know that, you know, I've heard people talk about how convoluted the healthcare billing system is, and the entire way we fund healthcare, how convoluted it is. And so you kind of get the sense that something's wrong, but you don't really know what is wrong. And so we kind of wanted to find out, well, what is wrong or what could be improved? And nobody really defends the status quo. very much. It's a lot of people talk about how things need to change. Well, then, so what needs to change and how would it need to change in order to solve these problems? So as John was saying, we solicited stories and we combed through, many dozens of stories and trying to get to talk to people who were willing to share their story and share their name, and then give us let us see copies of their bills, and then try to decipher what happened and with them. And this is not easy to do. It takes there's a lot of so if any one of those conditions isn't met, then we pretty much have to just throw that story off to the side. And so anyway, so that's so we went through this, and then in addition to talking to all these different people about their stories, then you can kind of bring specific examples to various experts in the field, whether it's people who are experts with medical billing, people experts on the healthcare provider side, hospitals, insurance experts, people who are who send out and deal with billing disputes all the time, and try to piece together all the elements of this story, and find out what other countries and other states are doing to try to address it.
Were you surprised, Joe, how many responses we got? I personally was, and I know that not everybody was willing to share all their personal details, but we got
a lot of responses. I was surprised at just the sheer volume of it, but I guess that when I thought about it a little bit, it was very relatable. We've all gotten bills in the mail, and maybe we ended up paying it, but we were like, should I have paid that? Like that's it's just a very common experience. So
the other thing I noticed, Joe, and that surprised me, is we thought, because we started thinking about it through the Anthem Maine Health story, that they were going to be the focus of a lot of the the horror stories we got, but it looks like, at least from the ones that you ended up reporting on, that there was really no common thread in terms of, was it a specific insurance company or a specific healthcare provider? It was all of them, or a lot of them.
Yeah, the problems are system wide. If I could indulge you and our viewers a little bit, my old high school teacher, when there was something difficult to explain, liked to use analogies. And so,
hey, Joe, you froze, I think.
I'm not frozen. Are you frozen, John? Okay. So anyway, my old high school teacher liked to use analogies. So I thought it would be maybe illustrative to show people, well, what happens between when you go to the doctor or go get a healthcare service and getting a bill, and using the analogy of ice cream, as hopefully everybody can see this behind me. So if you can imagine, like if a hot summer day, you're going to your favorite ice cream place, whether it's Red's in South Portland or Lib's in Portland or Fielder's Choice. And if you can imagine going there, and then the ice cream server, you look at the list of flavors: chocolate, pineapple, vanilla, maybe strawberry, etc. You look at the list of flavors, and imagine if there were no prices next to them. And then you ask, well, the ice cream server, well, why aren't there any prices? And then the server says, you don't really want to see the list of prices. Just order something. And then you say, well, no, I really do want to see it. And now there is a law that says you can see the list price at any hospital. But to imagine, using the ice cream analogy, if they said, okay, we'll give you the list of prices, And here's our list of, it's called our charge master list. And here's our list of prices. And you had to take out a magnifying glass to look at it. And they all had little codes next to them, little numbers, and it was really hard to read. But finally you read it and you saw, chocolate was $200. Pineapple was $400. And vanilla was $700. And you looked at that and you're like, what, are you crazy? I'm not paying $400 for an ice cream cone. And the ice cream server said, see, I told you not to look at that. That's not what you'd really pay. Why don't you just order? And then the ice cream server says, actually, what you should do is you should give me your ice cream insurance card. So then you give them your ice cream insurance card. And then he said, well, can't you tell me what the prices are now? And they say, no, not yet. Because next what has to happen is you have to figure out what plan that you chose with your ice cream insurance, and then you can tell you what the price is. So after all that, maybe chocolate is $3, pineapple is $3.50, and vanilla is $4. And but this is the result of a big negotiation between your ice cream insurance company and your ice cream stand. And in addition to that, it depends on which ice cream plan you chose for the year, depending upon how much it costs. So it's the bill that you get in the mail is 3 steps removed from what the prices are. And actually, you normally don't even see what the original prices are. And so this is why things are so convoluted. And then also imagine if you went and you got a strawberry milkshake at one stand after you gave them your ice cream insurance card, and it was $3 at one place. And then you go to another ice cream stand and you say, I want a strawberry shake. Here's my ice cream insurance card. And then they give you a shake and they say, that's $75 for your store. And you're like, but I just paid $3 at the other place. And they're like, well, we're out of network. we're not in your network, or any number of reasons why it could cost way more, and you would have no idea. And this is what happens in a very try to make it in a very simplified way with your medical bills. And that one of the stories that struck me was there was this man from Westbrook, and he went and he had 2 years in a row he had abdominal pain, and he went and he got a CT scan on his abdomen at one place. It cost him $800. The next year, he went and got a CT scan for on his abdomen, and it cost $3,000 for the exact same service. And so, and there's a lot of times there's no way to know beforehand. And sometimes we've had cases where people call in advance and ask how much it's going to cost them, and then it ends up being way different than what they even originally thought it would be. And so, as you can see, like how, if you went and got, now if you go and get ice cream in real life, it's simple. You go and you see the prices and it's there. But that's not the case with medical billing. And yeah, I should point out one more thing with the ice cream analogy. So one thing about ice cream is it's all voluntary. It's all, if you feel like having ice cream, that you go out and you have an ice cream cone. But medical services oftentimes are not, you need to have it done. Like there's no not having heart surgery if you need heart surgery, right? And so it would be like going to the ice cream stand and saying, and they would say you have to eat this banana split, and if you didn't have insurance, the banana split would cost $500. If you were out of network, the banana split would cost X number of dollars, whatever the case may be, and you don't really have a choice. And so there's anyway, there's a lot of differences. There's a lot of people think, well, why can't medical pricing be the same as going to an ice cream stand or going to a restaurant or ordering a pizza, etc. And it's just such a different. It's a service, not so much discretionary versus discretionary spending. And so it's this kind of weird hybrid.
Can't think of anything else where we buy a service or a product and wait for a few weeks to find out what it's going to cost us. And
that's the other thing. That's a great point. And I don't mean to interrupt you, John, but that's a really important point, is that a lot of times people are waiting months and months, not just weeks, months and months to get a bill. And then when they get a bill, they can't tell whether this is the last bill or if they're supposed to get more bills. And so during that whole time, you could say, you're kind of on pins and needles. Like, is this going to cost me, $10,000, especially if you had, some major surgery done, or there's just going to be, it's hard to figure out. Yeah. And then I also want to say, there's another side to this, and you touched on this, is that it's hard to tell a lot of times what your insurance will cover and pay for and what they won't. And then a lot of times people are getting these denial letters in the mail saying their insurance denied it. And then later the insurance ends up paying it, but it may be months and months later. And so it's just a very confusing way to do business.
Yeah. One of the stories you wrote, Joe, I think one of the more helpful ones was, it included some tips on how to try to avoid the surprise bills and the surprise denials from the insurance company. And some of the people you wrote about did some of those things, right? They called the hospital or they called the insurance company. They got the cost. They avoided, they compared prices. One of the important, you can compare the list prices, right? And they vary so much. It really doesn't seem to make any sense. You gave the example of hip replacements, right? At one hospital or one clinic could cost $26,000, and somewhere else in Maine could be $53,000.
Right.
So there are people who are somewhat educated about this. They look at the prices. They call the insurance company, and they do the things that you would think you should do as an educated consumer. But then you get your bill, and there's still a surprise charge in it.
Right. So yeah, I mean, this is a great example. So this is a good resource, and I'm not saying anything bad about this resource. We're fortunate to have it. It's called comparemaine.org, and it was brought into the state government, brought this about, and you can, for any number of services, compare the cost, and you put it in. And so, yes, like you can see, for this case, a hip replacement, you can get it done Central Maine Orthopedics for $23,000, or up to St. Joseph Hospital for $57,000. But what it doesn't tell you is how much your insurance will cover, whether it's in network with your insurance, and what your insurance plan will cover. Yep. So, and those things could make a huge difference. So it actually do make a huge difference. So, and just because something is you look at it and it may be lower priced on there, that doesn't mean that would be the best
Right.
choice, because it's all dependent upon your insurance plan, your insurance carrier, and then what plan you chose at the beginning of the year.
Right. And you had that good example of the facility fee, which we should talk a little bit more about. But a patient who, did his homework beforehand and got the bill he expected in one respect. The service, which was a cardiac stress test, actually cost him $45, but his bill included a fee that wasn't really clearly labeled. And he had to do some of his own investigation to find out what it was. And that was this thing that I did not know about until you did these stories, called a facility fee, which apparently is a growing issue, I guess. Can you talk about that?
Yeah, best I can tell is this is something that's more common. And then also, I would be remiss if I didn't mention that all of these issues are actually, patients are starting to see them more, because the healthcare insurance has shifted to more higher deductible plans, higher patients sharing the cost of healthcare as employers seek to limit their healthcare costs and try to still offer good coverage. And so yes, you're in comparison to 20 years ago or so, you're less likely to go bankrupt because a lot more people have insurance, but there's a lot of people who are underinsured, who have insurance, but they have these higher deductible healthcare plans. And so then they end up seeing a lot of these fees, a lot of these costs that in the past, I mean, if the chocolate ice cream cone cost $50 or $100, if your ice cream insurance was paying the full cost, it wouldn't matter to you whether that was $50 or $100. But if you have to pay some of that, then it does start to matter. So anyway, getting back to the facility fees, this is a way to recoup costs that hospitals argue and say that are not being paid for in other manners through insurance plans or through negotiations with insurance companies, et cetera. And like it's the cost of operating the full range of services and the building costs of the hospital, and all these things are built into it. And what's happening is sometimes insurance companies will pay a good amount of that, and then the patient doesn't see very much of it, and other times they're not paying very much of it, and then the patient is on the hook for a larger portion of it. There was one of the better stories about this was there was this man from Portland, Sean, and he cut his thumb open on Christmas morning peeling potatoes, and it was kind of a bad cut, and urgent care was closed because it was Christmas. So he went to the hospital and they bandaged it up, and he has a high deductible healthcare plan, and he ended up spending over $500 just on the facility fee for going to the hospital. And he was like, if he had been aware of this, if there had been a sign up or something to tell him in advance, he would have just bandaged it up and on the next day go to urgent care or his primary care doc. But these are the kind of things that decisions that people make in the spur of the moment because they're hurting, and yet they're getting socked with these fees.
Yeah.
So,
at the moment, there's no requirement that those fees be disclosed ahead of time, right?
not that I'm aware of.
And they're not always clearly labeled, right? How do you know?
Yeah, and they're not always
How do you
clearly
know
labeled. You have to ask for them, and right. And
how do you find out? You ask for. You basically have to ask for a breakdown of
right.
a chart.
Right.
Yeah.
I was noticing that I think the facility fee, say you go to the hospital for, I don't know, heart surgery or kidney surgery or something, and you're kind of expecting a big bill, and then maybe there's a facility fee tucked into your bill, and if it costs 15 grand and your insurance pays say 12 of it, and you have to pay a few grand. I mean, I think a lot of times people don't notice it because they're already expecting to be, they realize they're going to have to pay something because they had surgery in a hospital. But I think where it gets people complain about it more, and it's more noticeable, is when you just go and get something routine done, and then comes back and it's this big giant bill, and insurance won't pay for it. Although I will say, in one of the cases, at the end of the day, the insurance did pay for it. But it took many months of complaining and wrangling, and so.
Yeah, and that was just recently, right? It took months. Do you know why?
No, I still don't know why for that one. So yeah.
That was one of the striking things that came up in several of the stories, that bills or denied claims got resolved, and the patients still have no idea why. Right. The family. So we talked more about on the provider side, the charges, the fees, the varying costs. But on the insurance side, you had some examples of claims being denied for reasons that patients never understood. And sometimes the insurance company would relent and cover them, and still there would be no explanation. How can you explain that? And how do people get help when they have a claim that's denied and they can't tell why?
I mean, there's no magic answer for this, so you could try, always talk to your insurance company. Obviously, any claims that, you can also appeal to the Bureau of Insurance if there's a long-running dispute. Another really great resource is Consumers for Affordable Healthcare, which a part of their mission is to try to help people with their bills and try to decipher what's happening. But yeah, there's no magic answer to that question.
There is an appeals process. The insurance company would have
There's always an internal appeals process, right? And then you could do a formal appeal to the Bureau of Insurance. But from what I understand, that's time consuming and not necessarily an easy thing to do. So you could always try, another thing people do is try talking to their healthcare. If it's a case of insurance denying, if you talk to your healthcare provider, a lot of times your doctor or people that work in medical billing for your provider will know, okay, let's try to bill this under a different code, and maybe that will work in terms of getting the insurance to cover it. Because there's a lot of, going back to my ice cream example, imagine if there was 6 different codes for very slight variations in chocolate or pineapple ice cream. I'm not talking chocolate versus Rocky Road. I mean chocolate versus, chocolate that has a very slightly different amount of cream in the recipe. There can be just very slight differences in how they code it, and then sometimes that will do the trick. So, yeah. But there is no magic. There is no magic answer that I can tell.
I think that's kind of the takeaway for me. So the difference, I mean, everybody could relate to the Maine Health Anthem thing because we've had our own experiences, but the big difference is, those guys, well, they were talking about tens of millions of dollars for one thing, but, they have immense power in the market, to challenge if they think they're being overcharged or undercompensated. They have huge power. Those are big players in the market. But what that whole dispute kind of illustrated too was that patients are more or less powerless and at the mercy of these big forces. So Maine Health and Anthem settled this dispute last week as it happened. But if they hadn't, there'd have been, tens of thousands of patients who would have had to pay higher fees out of network costs at Maine Med.
Yep.
And the individual patient fighting a bill or a insurance decision is really in a tough spot.
Yeah, you have no leverage.
We've
So
seen it can work. It takes months sometimes of pressure. You talk to people who wrote to their Congress people, and
yeah, I think maybe sometimes in individual cases, I wonder after hearing these stories, with people maybe after years of fighting, eventually they get a breakthrough. And there's this one case, this one Portland woman, she spent a lot of time fighting, and part of me wonders whether, if you just make a pest of yourself for long enough and are diligent enough, that eventually they see it's more of a issue to, instead of keeping that going, let's just settle this case with this person. But I mean, why should it be like that? Why should why should people have to go through these very lengthy fights if it's coverage that their plan is supposed to cover? So.
I mean, there's just an impact on people who have to go through that process. The couple with the new baby was a disturbing example of that, where they thought they were going to be having to pay a massive bill, and then suddenly it went away, and I guess they still don't know why, right?
Yeah, yes, they still don't know why. There's some speculation as to why, but yeah, they had a $360,000 bill hanging over their heads for half a year because their baby was born prematurely and needed a stay in the neonatal intensive care unit for a good while, and so that's expensive. Clearly, that's an expensive service. Why the insurance would initially deny, I don't know. I want to make another point, in that just like in other areas of healthcare, like prevention is a good thing. If you can prevent a large bill, there are ways to do that, and so one of the ways is to really, before you have something done, if you know that you need it done, to really research with your insurance company, and I know this is not foolproof, as we've seen with these stories, but still, like, research with your insurance companies, like which provider, still provides good quality service, but is lower cost. A lot of these diagnostic centers, for instance, for, like, say, MRIs or et cetera, generally the ones that are independent, that are not hospital affiliated, tend to be less expensive than going directly to a hospital to, say, get an MRI or some diagnostic work done, or colonoscopies, et cetera. There are ways to, and actually, that's the insurance companies are incentivized to help you with that, and so that was a piece of good advice that I got.
I should note that in the comments, I'm seeing that
universal healthcare. Yeah, I'm sorry. Go ahead, John.
We'll probably get to that, I think, too, in the questions. But clearly, there are some providers in our audience, Joe, who make the point that you also had in a story, that for the independent, or for a doctor or medical provider, this is also a huge time waste, basically. And a frustrating process, right? You talk to a provider who's
right
having the same issues that patients are getting bills paid.
Right. And she said that she spends so much time with dealing with billing issues that if she could cut that down by a large portion, she could see, say 20% more patients. And then, we think about that in terms of the workforce shortages in all kinds of industries, including healthcare. And this is a whole other story, but you hear these stories about how difficult it is to get, for instance, say, to get mental health treatment. And so then you think about, well, if these processes were streamlined, you could have the same number of people providing more services. So that's a thought. Can we pivot to the single payer universal health care?
Yeah, let's talk about different ideas for solutions. And
I think we have a couple of graphics that kind of highlight some of this as well, if those can be put up.
Yep.
But this shows this is a study from a group called the Commonwealth Fund. They're based out in New York City, and they do a lot of research on comparing healthcare systems between countries, and they advocate for improving the U.S. healthcare system. And as you can see, it's in all of these other countries have some form of single payer or universal coverage. Countries that in many ways are, there's some similarities. Canada obviously has some good similarities, the UK, and we are like, what, triple the amount of people who, now this, to be clear, this is people who earn below average income, so this would be working class. We said they had serious problems or are unable to pay a medical bill. 1/3 of those versus 7% in the UK, 13% in Canada, roughly 15% in France and Sweden. I think there's another one that is similar. Percentage of those surveyed in each country with below average income who reported cost-related problems getting medical care, so accessing the care that they need. And even and I think most of your healthcare experts would say that post ACA, there is a lot more accessibility to having insurance and being protected from like the absolute worst outcomes of having a massive heart attack and then ending up being bankrupted on top of that. But with the high deductible plans and plans that are costing more out of the patient's pocket, people are still having problems paying their bills. 50% in the U.S., Canada 21%, et cetera. You can see, and then you measure another part of this, which we don't have a slide for, but you measure the U.S. in comparison to all these other countries in our health outcomes, and many metrics we have amongst the poorest health outcomes in terms of the one that comes to mind, a few that come to mind are suicide rates and also problems with maternal health problems, postpartum, pre and postpartum health problems, and the health of babies upon birth, and a whole host of other issues of where we have worse health outcomes. So we're spending the most on an individual and as a society. We're spending all this money, but our return on investment is not good, according to the studies. That's not just my opinion.
Yeah, so that kind of gets us into some questions from readers that we have, Joe. And
absolutely.
Somebody asked, would Medicare for all or some other single payer system solve these problems? And second part,
I want to right, and I want to. This is also a point that I should make. It's not. If you wave the single payer magic wand, that doesn't mean that all the problems are solved. By far from it. And in fact, I've had different people point out to me, Andy Mueller, who heads up Maine Health, and then also another healthcare expert was telling me, if you don't fund properly a single payer system, then you're going to end up with massive cuts in healthcare services. And so, you know, you're going, in order to do this, you would see a really big increase in taxes. There's no way around it, because you are going from this hybrid system that's partially government funded through Medicare, Medicaid, et cetera, to whole hog funded by the government. And the only way to do that is to raise taxes, and not just raise taxes a little bit, but raise taxes a lot. Now, so the danger is, if you don't fund it enough, then you end up with a really shoddy healthcare system where the services are way cut back from what we have now, even. And then, you know, but on the opposite side of that, people would say, well, but look at how much we're paying now, and so maybe it'll be better to have a completely publicly financed system, because in the end, when it all shakes out, it's going to be a lower cost. And yes, it might be higher taxes, but your total costs will be lower. And that seems to be borne out with these studies comparing our costs with these other countries that do have single payer. And I also wanted to point out that there are steps in between, and I think one of the more common ones that you hear about is reducing the Medicare age eligibility to, say, 55 or 50. And I mean, I don't want to sugarcoat it. That just doing that obviously would require an increase in taxes or fees or some type of dedicated revenue stream. But doing that, obviously older people are more likely to have, you know, higher healthcare costs than younger people. And so by having Medicare for lower age thresholds, that might help with preventing some of these, you know, larger medical bills that people can't pay. So,
you know, and you wrote about it, and it's obvious there are huge political obstacles to doing this in this country. And oftentimes for big reforms like that, they start at the state level, right? Kind of like Affordable Care Act did. Yes. So are there states that are doing this or trying it?
Well, single payer, I would say it doesn't seem like it yet. I mean, there's been some, you know, Vermont rather famously tried to do it, and then they found out how much their taxes would increase, and they balked. And it's not just that, but I think trying to implement a system in a small population state like Vermont or Maine or New Hampshire, et cetera, would be hard, because that individual state doesn't have a lot of overall clout for the entire healthcare system. Whereas you take a state like California or New York, they do, and and there's been some talk about it in California, but honestly, when I was looking into it, it didn't seem like they were anywhere close to it. It seems like a very difficult political proposition.
And we had a lot of questions along. I think we talked a little bit about this earlier, that you know, resources for getting help with a bill or a you know, insurance claim denial. You mentioned the Consumers for Affordable Health Care.
Yeah.
What did they do for people in this position?
They have a helpline. I'm sorry, I don't have the number right in front of me. If there's a way to look it up super quick, somebody they have a hotline that you can call. And do you see it there? Oh,
It's up there. Yep.
oh,
Thank
okay. 1-800-965-7476.
Yep.
And it's in our chat.
And we
And
can
so
walk you through the
I mean,
options.
they, like I said, there is no magic bullet, magic pill, etc. But they certainly can help point you in the right direction.
Yeah. Someone asked, they got different invoices. So multiple bills for the same procedure from different service providers, I'm imagining. I don't know if you came across that in any of your examples, but I know that sometimes the breakdowns on the bills are confusing.
I have no doubt that there are sometimes where people get charged mistakenly, twice for the same service. And I mean, hopefully, if you notice that, then that would be an easy fix to take that charge off. I mean, I guess you would always ask for an itemized bill. That would be like one of the very first things you would do.
Yeah. In the stories that you collected, Joe, which ones kind of surprised you or troubled you the most? And have you heard from some of these people after the stories ran?
Yeah, I mean, people just were, said, they were happy that we highlighted the issue. I think to me, it's like the thing that was really that I kind of a big takeaway for me is that there's always like really terrible horror stories. Maybe somebody was charged, tens of thousands or $20,000 more than they should have been, and ended up with massive amounts of debt. And I have no doubt that that's happened. But I think it's really relatable, because I think we've all gotten that bill and you think to yourself, is that maybe like $500 or $800 or $1,000 more than it should have been? And then frankly, a lot of times you're just like, well, maybe, but I just want to get rid of this. I'll just pay it, So I think that's very, and then but the stories that I received, of course, were people who weren't just doing that, or maybe they did it, but after they realized, yes, I am definitely getting rolled over. So those are just very relatable stories.
Yeah. Did you have any trouble getting, either hospital executives or insurance company officials to talk about?
No, they were pretty good. Yeah, I mean, they were pretty good about answering my questions and explaining why things are the way they are. Like I said, nobody really defends like the whole system, but at the same time, no one actor on their own can solve the system, as was pointed out to me, because they each have their own vested interests. And so in order to really change things on a comprehensive basis, it's going to take a huge collective effort by like all kinds of people. And one thing that's always been pointed out to me is oftentimes, like there's these massive negotiations between Maine Health and Anthem that we were just writing about, and people with Consumers for Affordable Healthcare point out to me, well, where are the patients at the table in those negotiations? They're not. They're absent. And so, this is where you could get, back when I was learning social studies back in high school, they would say, well, collective action by your elected representatives and state government working with people to try to do collective action to change the system in a comprehensive way to improve it is the way to do it. Schoolhouse Rock, I'm just a Bill kind of thing. But we all know it's pretty hard to pull that off. Like that's not an easy task. So anyway.
And that, I mean, that it worked, well, it happened. See how well it works, but it happened with the this law that was just passed and signed by the president, included some changes in Medicare, right? But it took years and years to
decades, like Medicare negotiating drug prices to lower the cost of, that's like to be a complete no-brainer, like, and that took decades of advocacy. So that just shows the kind of the inertia that's involved with these systems. I saw on the chat how it's start in Canada. You know, it's these reforms would start in one province and then it would be a success and then spread to other provinces. And you know, I mean, I'm not going to discount that, but I do think a lot of times these reforms, like it seems like, you know, happening at a bigger state than Maine seems more likely, and then spreading to other states. But who's going to be the first one to do it? I don't know. I mean, but at the same time, the precursor to the Affordable Care Act started in Massachusetts and then spread to now it's the law of the land in the country. So, you know.
Yep. One reader asked whether you heard after the publication, did you hear from medical providers about it, either sharing their own stories or in any sense?
Yeah, I mean, well, I mean, from medical providers themselves, not too much so far, but it's still early. Shout out to the person who made the Canadian point, Elizabeth Solette, if I'm pronouncing her name correctly.
Great. And again, I wanted to ask you again, you talked to a lot of people who didn't appear in the story, who may also have had just real horror stories, but
Sure.
for various reasons weren't in the story.
Not everybody wants to share their story, and that's fine. That's just the way just the way it goes. Yeah.
I was kind of amazed that as many people as you had were willing to, you know, provide all these very personal health details and their bills, right? Because that was part of, you had to verify all of these stories and documents.
Right. Yep. I feel like there was another point I was going to make. You know, and that's not to say that, talking about state reforms too, that's not to say that there couldn't be some improvements done at state levels that could really help with this issue. You know, thinking of well, I mean, one example is on the federal level for Medicare patients, they just did a limit on the copay for insulin at $35. And if there's talk about having that, it was stripped out of the mega bill. I forget what it's called, Inflation Reduction Act. It was stripped out of that bill to have it apply to all insurance. But there's talk about reviving that, or maybe if that doesn't get done on the federal level, could be something states could do, maybe. And I think it could be. And you know, there's and I do want to make a point that Maine did establish a commission to study substantial healthcare reforms. I can't remember the name of the commission off the top of my head, but they're going to be studying it and putting out reports, et cetera. Whether it's just a commission that puts out a report and gets put on a shelf somewhere, or if there's some action taken at some point, I don't know. But
another thing reminded me of how consumers are kind of left out of these talks and are often just kind of at the mercy of the big players. We still don't really know how Maine Health and Anthem settled their big dispute, right? It just, it's a confidential contract and
Yeah,
we're
and
not talking about it.
I don't know of any way of getting access to that, because it's, like I said, we're in this hybrid system where our healthcare system, where some things are in the public domain and some things are not, and that is something that's not, as best I can tell. Somebody pointed out that Maine did pass a bill recently that did put some cap on insulin costs, and I don't remember exactly the details of that, but I do remember that being talked about. So there have been, certainly, and prescription drug reform, there's been some bills passed in Maine that have tried to limit the cost of prescription drugs, but I think I seem to remember the takeaway from those is that they were kind of mild reforms, and it's hard to without having a system with a lot of teeth in it, it's hard to regulate healthcare prices.
Yep. And we'll be looking at that. The next legislature could take up some of these issues. I guess there was mention from one of the advocates saying they hope to address facility fees somehow.
Yeah, that's frankly, that's an issue we're following, and we'll see what we'll see what comes of that.
Yeah. Yeah, that's good. I want you to find out how Maine Health and Anthem settled their contract too. That'll be next week. But it was interesting when they first had announced this impasse between the two of them. We got some real detail on their billing dispute, which is kind of an unusual moment of transparency when Maine Health and Anthem were kind of trading accusations about
Right.
billing and insurance denials. That was the Anthem accused Maine Med of a pattern of overcharging. What was the example they pointed to? Was $136 for the $2 bags of saline, I think.
Yeah, right. And that's that's an outrageous amount for a bag of saline. But the hospitals would say, well, there's all these other costs that we're not charging you for, so we're just kind of like loading it into certain things. That's how you get like $50 for an aspirin, or et cetera, because they're saying they're not charging for other services.
Right.
So, but I mean, I don't know. It's definitely like exceptionally complex, and I think kind of getting back to one of the earlier points is that from the perspective of a healthcare provider or a hospital, they're just trying to make the numbers balance at the end of the year, and however that gets done. And so that's why they're not looking at the cost of X or Y or Z service, because they're trying to, I mean, they are, but I mean, that's why they're not like competing directly with each other on X, Y, and Z service, because the hospital is looking at it from, how do I make my numbers, and then let's put it all together and into our formula and get the numbers to even out, so that we break even or are allotted 1 or 2%, because these are mostly nonprofits, right? So they can't have a profit per se. But then when you're on the receiving end of the spot where they loaded the money into, or the charge into, and it happens to show up on your bill and you have a high deductible plan, and then you're directly affected. So anyway,
Yeah, one of
I
the,
tried to explain. I hopefully I was explaining it okay, but it's hard to explain.
I think you did a good job. The ice cream analogy, man, that was it.
You're gonna have to go get some ice cream now tonight. So
Yeah. Ice cream sales are up. I think we are just about out of time. Waiting for the high sign there, but I want to thank you all for listening, being here, and offering your questions. Feel free to email Joe or me with any feedback or questions. Special thanks for
pistachio almond myself. That sounds pretty good.
that's Joe's favorite. Special thanks to all of the subscribers who make this kind of journalism possible, and we will do our best to do more of it if you keep reading. And everybody else out there who hasn't subscribed, you can do that. There should be a link, I believe, in the chat. And we hope you will join us and support the journalism that people like Joe do here every day.
Thank you, everybody.
Thank you.